Welcome to the Deep Dive, your source for unraveling complex topics. Today, we're confronting one of the most critical and, well, often baffling emergencies in horses, intra-abdominal hemorrhage.
Yeah, it's a condition that can escalate incredibly rapidly. So early recognition and, a deep understanding are just absolutely vital for anyone involved with horses.
Right. We're going to peel back the layers today, look at exactly what this internal bleeding entails, uncover its, well, surprisingly diverse causes, walk you through how veterinarians actually zero in on a diagnosis, and then discuss the critical treatment options and, what the future might hold for an affected horse.
Basically, yeah.
Our mission today is really to arm you with the essential knowledge to understand this really life-threatening challenge. So if you've ever wondered about the hidden dangers lurking inside our equine companions, well, prepare for some truly eye-opening insights.
Definitely.
Okay, so to kick us off, what exactly are we talking about when we say intra-abdominal hemorrhage or maybe hemoperitoneum? What does that mean for the horse itself?
Okay, simply put, it's blood pooling inside the horse's abdominal or peritoneal cavity, basically, where it absolutely shouldn't be.
Right, bad spot.
Exactly. And this isn't just a minor trickle. It can range from subtle chronic bleeding that might go unnoticed for a bit to a sudden massive hemorrhage. And that can lead to hypovolemic shock, a life-threatening state where the body just isn't getting enough blood circulating efficiently. And it can be fatal.
Wow. So a serious invasion of blood into the wrong space.
Yeah.
What happens to the horse's body then, particularly in those acute massive bleeding events?
Yeah, in cases of acute significant blood loss, especially if it's, say, 30% or more of their total blood volume.
Which is a lot.
Oh, it's huge. For an average horse, that's about 10 to 12 liters.
Wow.
The primary concern is absolutely that hypovolemic shock. But here's a fascinating and really crucial insight. Initially, the horse's spleen actually contracts. Yeah, think of it like an internal blood reserve. It tries to push out stored red blood cells to maintain what we call the packed cell volume, or PCV. That's a measurement of red blood cell concentration in the blood.
That's incredible. So wait, if an owner or a vet does a blood test right away, the PCV might actually look normal, even if the horse is actively bleeding inside. That kind of challenges a common assumption, doesn't it?
Exactly. And this is such a critical piece of information for any owner or vet. In the initial hours, sometimes, believe it or not, up to 24 hours.
24 hours.
Yes, the PCV might appear normal despite significant blood loss because the body is trying so hard to compensate. And if it's a slower, more chronic bleed, the body has even more time to shift fluids from other tissues into the bloodstream, essentially diluting the remaining blood, and it can even reabsorb some red blood cells from the abdominal cavity itself.
Huh. Autotransfusion, basically.
Sort of, yeah. It can mask the true severity for quite a while.
Which body systems take the biggest hit when this is happening?
Well, the cardiovascular system is always the first and most severely impacted. That leads directly to the shock.
Okay.
You'll also see effects on the urinary system. Decreased urine output is common. And very commonly, signs of colic or abdominal discomfort because, the blood irritates the gastrointestinal system lining.
Right. Makes sense. Is this a common problem, though? Like something horse owners should constantly be worried about?
Thankfully, no, it's actually uncommon. However, there are certain horses that are more predisposed.
Okay.
We tend to see it more often in breeds like Arabians and thoroughbreds, and particularly in older horses, typically those over 13 years of age.
Older horses, okay.
And for mares, the risk increases significantly with age and multiparity, meaning mares who've had multiple foals,
Okay.
especially those over 11 years. They're considerably more vulnerable due to potential reproductive tract bleeding.
That leads right into my next question. Let's talk about the sources of this bleeding. I'm really curious about the range of causes here. And beyond the obvious trauma, what are some of the maybe more surprising ways this can happen?
Right. Well, starting with the more straightforward ones, external trauma is certainly a common culprit. A kick from another horse, a collision, maybe a fall.
Sure.
That can directly injure vital internal organs, spleen, liver, kidneys, or damage major blood vessels. Even intense exertion, like racing, can sometimes lead to an organ rupture, especially the spleen, if there's some underlying weakness there.
Okay. And then you mentioned mares. There's a whole category specific to them and their reproductive tracts, which sounds particularly, well, devastating.
It absolutely can be. What we call periproturiant hemorrhage, that's bleeding occurring around the time of foaling, is a significant and unfortunately often fatal cause in mares, especially those older mares who've had multiple foals.
Right.
The most common source here is the rupture of the middle uterine artery, often within what's called the broad ligament.
A broad ligament.
Yeah, to clarify, it's kind of a fan-shaped fold of tissue that basically supports the uterus within the abdomen. Now, bleeding can be contained within this ligament, forming a hematoma, a localized collection of blood, which you can often feel during a rectal exam. But critically, it can also rupture out of the ligament directly into the peritoneal cavity.
Oh, wow.
And that leads to massive, often life-threatening bleeding into the abdomen itself. Other reproductive causes can include things like large ovarian hematomas, blood clots on the ovary, ruptures of what are called corpora hemorrhagica, basically frank blood clots after ovulation, or even trauma during the foaling process itself.
So it's not just external forces or foaling. What about internal growths? Like tumors, can they cause this kind of hemorrhage?
Yes, absolutely. Neoplasia or tumors are indeed a critical cause. Hemangiosarcoma, for instance.
Hemangiosarcoma.
It's a highly aggressive malignant tumor that starts in blood vessels. It can pop up in various abdominal organs and is, well, notorious for suddenly rupturing and causing massive internal bleeding.
That sounds awful.
It is. While other vascular tumors can also bleed, hemangiosarcoma is particularly concerning just due to its aggressive nature and that tendency to bleed catastrophically.
You also mentioned other organ ruptures beyond just trauma. What's involved there?
Yeah, the spleen, as we touched on, it's a highly vascular organ, right? Very susceptible to rupture, not just from external trauma, but sometimes even due to an underlying hematoma or a mass within the spleen itself.
Okay.
Liver and kidney ruptures are less common, but they are also possible sources of significant internal bleeding.
This makes me wonder about some of the more, I don't know, unusual, almost insidious causes. Like, could something as seemingly minor as a parasite infestation lead to this? Is that possible?
That's a truly insightful question, and yes, it absolutely can. Mesenteric artery aneurysms.
Aneurysms.
Yeah.
In the gut arteries.
Exactly. Weakened, ballooned areas of blood vessels supplying the intestines. They're a classic example of an insidious cause, and these are often linked to the larval migration of a specific large, strong, mile parasite, Strongylus vulgaris.
Wow, a parasite.
Yeah, the larvae migrate through the arteries, causing damage and inflammation, which can lead to these aneurysms. If one ruptures, well, it leads to fatal hemorrhage.
That's terrifying.
It is. It's a truly grave prognosis, sadly, and just a stark reminder of the hidden dangers of certain parasites. Less commonly, you might see a renal artery rupture or even extremely rare aortic ruptures.
What about the horse's own blood clotting system? Can problems there be the source?
Absolutely. Coagulopathies or bleeding disorders, that's another important category. Now, primary inherited disorders are quite rare in horses.
Okay.
More commonly, we encounter acquired coagulopathies, things like disseminated intravascular coagulation or DIC.
DIC, I've heard of that.
Yeah, it's a severe systemic condition where the body's clotting system basically goes haywire. It goes into overdrive and then crashes, leading to both excessive clotting and widespread bleeding throughout the body.
So it causes both problems.
Paradoxically, yes. And DIC is never a standalone condition. It's always secondary to another severe underlying disease, often something like sepsis or massive trauma.
Got it.
Ingesting anticoagulant rodenticides is another acquired cause. And very rarely, certain drugs like NSAIDs, if used at toxic doses, can also interfere with clotting.
And what about after surgery? Say, colic surgery. Can bleeding develop then?
Indeed, it can. Post-surgical complications are definitely a recognized cause. For example, a ligature might slip that's the surgical knot used to tie off a blood vessel, or maybe a vessel just wasn't adequately sealed during the abdominal surgery itself, like colic surgery or even some castrations. That can lead to significant internal hemorrhage later on.
Okay, so with this huge range of possibilities, do veterinarians always manage to actually pinpoint the exact cause of the bleeding?
You know, surprisingly, no. In a notable percentage of cases, especially you see this in older horses, no definitive cause can be identified, even after a really thorough diagnostic workup.
Really?
Yeah, these get labeled as idiopathic, meaning the cause is just unknown. Interestingly, some of these idiopathic cases can still respond quite well to conservative management.
Okay, so given this wide array of potential culprits, how do vets actually go about diagnosing intra-abdominal hemorrhage? What are they looking for, and maybe what should an owner keep an eye out for if they're concerned?
Yeah, diagnosis is definitely a puzzle. It relies on a combination of clinical signs, a thorough physical examination, and then specific diagnostic tests. The severity of the signs you see, well, it directly correlates with how fast and how much blood the horse has lost.
Right.
For an owner, recognizing those early signs can absolutely be life-saving.
So what are those key signs? What would immediately raise a red flag for you?
Well, signs can range from really subtle to, catastrophic.
Hmm.
Colic or just general abdominal discomfort is common because the blood itself irritates the lining of the abdomen, the peritoneum.
Makes sense.
But with significant acute blood loss, you'll see those classic signs of hypovolemic shock we mentioned. Pale or even white mucous membranes check the gums, the lining of the eyelids.
White. Wow.
Yeah, white. An elevated heart rate, tachycardia, often over 60 to 80 beats per minute, an increased respiratory rate, weak peripheral pulses, and a prolonged capillary refill time press on the gums. The color should return in less than 2 seconds. If it's longer, that's a bad sign. The horse might also be sweating, appear weak, lethargic, or even collapse. If there's a really large volume of blood, you might even see the abdomen look distended. And in severe cases, even neurological signs like extreme dullness or even seizures
Seizures, too.
can happen. And sometimes diarrhea can also occur, usually due to insufficient oxygen supply reaching the intestines.
And once the vet arrives on the scene, what's their process like during the physical exam? What are they looking for?
They'll immediately and thoroughly assess the cardiovascular system, focusing on heart rate, the quality of the pulse, is it strong or thready, mucous membrane color, capillary refill time, all those things we just mentioned.
Okay.
They'll also check respiratory rate and effort. Abdominal palpation might reveal distension or signs of pain. And a rectal examination is absolutely crucial, especially for those postpartum mares, to check for those broad ligament hematomas or other reproductive tract issues we talked about.
Right. Now, thinking back to what you said about the spleen and compensation, you mentioned that PCV, a pretty standard blood test, might not drop right away. So if that initial blood test isn't definitive, how do vets confirm significant blood loss early on? That feels like a major diagnostic challenge.
It truly is a major challenge, yeah. And this is where relying on just one single test can be really misleading. The key insight here is that serial PCV measurements are essential.
Serial. So checking it repeatedly.
Exactly. Checking it every few hours will reveal that progressive drop if the bleeding is continuing. Along with PCV, the total protein level in the blood often decreases too. However, a more sensitive and often earlier indicator of significant blood loss and poor perfusion, meaning blood isn't flowing well enough to the tissues, is the blood lactate concentration.
Lactate, okay.
Yeah, lactate levels can be elevated even before the PCV drops significantly. We sometimes see peak concentrations reaching 5.6 millimole or even more. Coagulation profiles, which assess the blood's clotting ability, are also vital to check for those underlying bleeding disorders like DIC.
Okay, so serial bloods, lactate. Beyond blood tests, what are the most definitive ways to actually diagnose this internal hemorrhage?
Well, abdominocentesis, that's the process of collecting fluid from the abdominal cavity using a needle, sometimes called a belly tap, is the most definitive test for confirming hemoperitoneum.
The belly tap.
Yeah. If you extract bloody fluid that does not clot in the sample tube, and its PCV is similar to the horse's peripheral blood PCV, well, that's diagnostic for active hemorrhage.
And this raises a really practical question for a vet performing that tap. How do they differentiate a true bleed from simply hitting a small blood vessel with the needle during the procedure, which could also give a bloody sample, right?
That's an excellent and absolutely critical distinction to make. A traumatic tap, meaning the needle just nicked a vessel on the way in, will usually result in a sample that clots in the tube.
Okay. Clotting is key.
Yes. And if you take subsequent samples, maybe from slightly different spots, the bloodiness will often clear up. In contrast, with true hemorrhage, the fluid in the abdomen has been there for a while, exposed to the body's clotting factors. So, on a microscopic level, true hemorrhage fluid won't have platelets present if it's been in the abdomen for more than about 45 minutes. They rapidly defibrinate, meaning the clotting factors that depend on platelets have already been used up or deactivated.
Interesting.
So what this tells us practically is if we see blood without active clotting or platelets, we know it's not just a fresh needle stick. It's a serious ongoing bleed that's been happening for some time.
That's a really powerful indicator. Okay, what about imaging? How does something like ultrasound fit into the picture?
Abdominal ultrasonography is highly recommended. It's non-invasive and incredibly useful.
Right.
It can show free fluid in the abdomen, which often appears echogenic, meaning it looks kind of bright and maybe shimmering on the ultrasound screen due to all the red blood cells and clots floating around. And crucially, it can sometimes help identify the source of the bleeding, like a large splenic hematoma or maybe that ruptured uterine artery in a mare. So yeah, veterinarians are really putting together a lot of pieces of the puzzle here to get to a diagnosis.
Okay, so once it is diagnosed, this sounds like an immediate life or death situation. What's the urgent action plan? What's the treatment approach?
Treatment is indeed an absolute emergency. It focuses on three main goals: stabilizing the horse, stopping the bleeding, and then, if possible, addressing the underlying cause.
Right.
The first and most critical priority is aggressive fluid resuscitation to combat that hypovolemic shock. This means administering large volumes of intravenous balanced crystalloid fluids like lactated Ringer solution very rapidly.
How much fluid are we talking?
Sometimes 10 to 20 liters for an adult horse, given pretty quickly. Colloids, which are larger molecules that stay in the bloodstream longer, like hetastarch, might be added for even more rapid expansion of the blood volume.
I've heard the term permissive hypotension, sometimes used in human critical care, in trauma situations. Does that concept apply here with horses?
It can, yeah, but it's a really delicate balance. What's truly fascinating and maybe counterintuitive here is that in some cases of active, uncontrolled hemorrhage, clinicians might intentionally maintain the horse's blood pressure at the lower end of normal rather than pushing hard to fully normalize it immediately.
Why would they do that?
Well, the idea behind this permissive hypotension is to try and avoid dislodging any nascent clots, those fragile early clots that are trying to form at the bleeding site. Pushing the pressure up too high, too fast, could potentially blow those clots off and worsen the bleeding. But like I said, it's a very fine line to walk. You absolutely don't want to compromise the horse's tissue perfusion too much. You still need enough blood flow to get to the vital organs.
Right, makes sense. When would a horse actually need a blood transfusion in this kind of emergency?
If the horse is severely anemic, let's say their PCV is rapidly dropping below 12–15%, or if they're showing signs of severe hypoxemia, that dangerous lack of oxygen in their blood due to ongoing bleeding, then a blood transfusion becomes vital.
Okay.
They typically need about 5 to 10 liters of fresh whole blood from a healthy, compatible donor horse. In really dire, desperate situations, something called autotransfusion, where blood collected from the horse's own abdomen is filtered and reinfused back into them, can even be life-saving, though it's certainly less ideal than fresh whole blood from a donor.
Got it. So beyond stabilizing them with fluids and potentially blood, how do you actually try to stop the bleeding itself medically?
Right. This brings us to a crucial question. How do we medically halt the hemorrhage? Antifibrinolytic agents are often used.
Antifibrinolytic.
Yeah, drugs like aminocaproic acid, often known by the brand name Amicar or tranexamic acid, TXA. These drugs work by inhibiting the breakdown of blood clots, so they help to stabilize any existing clots and prevent them from rebleeding.
Okay, stabilizing clots.
Exactly. If rodenticide toxicity is suspected as the cause, then vitamin K1 is administered to help the blood clot properly. There are also some anecdotal treatments out there, like Yunnan Baiao, which is a traditional Chinese herb.
I've heard of that.
Yeah, but it's really important to note that the scientific evidence for its effectiveness in horses is pretty limited.
Okay, so medical approaches first.
Yeah.
But what about surgery? When does that become the answer for a bleeding horse?
Surgical intervention, either via laparotomy, that's a full abdominal incision, or laparoscopy, which is a minimally invasive scope procedure, is indicated if there's massive, uncontrolled hemorrhage despite all that aggressive medical therapy.
Right.
Or if a specific surgically accessible bleeding vessel or organ can be identified. For instance, a ruptured spleen might require a splenectomy, actually removing the spleen.
Wow.
However, it's absolutely crucial that the horse is as stabilized as possible before going into surgery. Data shows that patients who don't respond well to medical treatment and then undergo surgery generally have a significantly lower survival rate. Surgery itself is a major stress.
Makes sense. And what about those broad ligament hematomas you mentioned earlier in mares? Is surgery always needed if that's identified as the source?
Good question. If the hemorrhage is contained entirely within the broad ligament and it's not actively rupturing out into the abdominal cavity, then medical management is often preferred. So supportive care, fluids, those clot-stabilizing drugs, and strict stall rest.
Why avoid surgery there?
Surgery in that specific anatomical area can be very challenging and quite risky due to the complex network of blood vessels. However, if the hematoma keeps expanding or if it's causing severe pain or other complications, then surgery might become a necessary consideration despite the risks.
Okay. What are some critical things that owners or even vets should know to avoid during these emergencies? Are there certain drugs that are just completely contraindicated?
Yes, that's extremely important. Certain drugs are definitely contraindicated or need to be used with extreme caution. Phenothiazine tranquilizers, like acepromazine,
Yeah.
generally contraindicated. They cause a significant decrease in blood pressure, which is exactly what you don't want in a horse that's already hypovolemic and struggling to maintain its blood pressure.
Right.
Also, the alpha-2 agonists like xylazine and ditomidine, they also decrease cardiac output, the amount of blood the heart pumps out, so they should be used really cautiously, probably at reduced doses if absolutely necessary for handling.
Got it. Okay, so let's say the horse gets through the immediate crisis.
Yeah.
What does the recovery period look like? What kind of monitoring is needed then?
Post-treatment monitoring is continuous and absolutely critical. You don't just fix them and walk away.
Right.
This includes those serial measurements of PCV and total protein to track blood loss and recovery, lactate monitoring to keep assessing perfusion, and just vigilant checks of all the vital signs. Heart rate, pulse quality, mucous membrane color, capillary refill time, over and over. Abdominal ultrasounds are often repeated periodically to look for any signs of rebleeding or new fluid accumulation. And crucially, horses need strict stall rest, sometimes for as long as 90 days after a really large blood loss, to allow for full recovery and healing without putting stress on anything internally.
90 days. Wow, that's a long recovery.
It can be, yes. Depends on the severity.
So putting it all together, what does this really mean for a horse that experiences intra-abdominal hemorrhage? What kind of prognosis are we actually talking about for their survival and recovery?
Well, the prognosis is highly variable, and frankly, it's often guarded to poor, especially initially.
Guarded to poor.
Yeah. It relies very heavily on the volume and the rate of blood loss. Massive, rapid hemorrhages, as you might expect, they carry a grave prognosis. But the underlying cause is also a huge determining factor in the outcome.
Can you give us some practical examples? Like, how does the specific cause really change that prognosis picture?
Certainly. Let's say the hemorrhage is due to acute trauma, and maybe the bleeding is self-limiting or it's successfully controlled with medical intervention. In that case, the prognosis can actually be fair to good.
Yeah, that's hopeful.
It is. However, if it's that periparturient hemorrhage in a mare we discussed, the outlook is very different. If the bleeding is contained within the broad ligament, the prognosis is better, maybe survival rates around 50%. But if that broad ligament hematoma ruptures into the peritoneal cavity, the prognosis becomes grave to poor. Death can occur within minutes to days.
That's dark.
It is. Similarly, hemorrhage from hemangiosarcoma generally carries a very poor prognosis just because of the aggressive nature of the cancer itself. And sadly, that mesenteric artery rupture from the Strongylosis vulgaris parasite, that's almost always grave. Coagulopathies like DIC also signal a poor prognosis because they represent a really severe underlying disease process.
So it really is a very complex balance of factors. What's the overall survival rate you typically see in cases that actually get treated?
Yeah. Overall survival rates for treated cases, looking at the studies, typically fall somewhere between 50% and 70%.
Okay, 50 to 70%.
Right. Horses that respond quickly to the initial fluid therapy and show rapid stabilization of their vital signs, they generally have a better prognosis. Conversely, those that come in with a very high respiratory rate, say over 30 breaths per minute, or those that are diagnosed with underlying neoplasia, extensive mesenteric injury, or DIC, unfortunately, they're much less likely to survive.
What about the long-term outlook for those horses who do survive the initial crisis? Are there lasting effects they have to deal with?
Generally, horses that survived the initial crisis actually had a pretty good prognosis for long-term survival, with surprisingly few complications most of the time.
Oh, that's good to hear.
It is. However, some might face, chronic anemia for a while during recovery, or maybe some lingering weakness. For mares who experienced a broad ligament hematoma, there is a potential risk for future infertility. But I think the most crucial takeaway from all of this, the absolute bottom line, is that rapid recognition, immediate stabilization, and aggressive targeted diagnostics and treatment are absolutely paramount. They're essential to maximize the chances of survival for any horse facing this. Every single minute truly counts.
Wow. We've truly taken a deep dive into equine intra-abdominal hemorrhage today, uncovering everything from these insidious ways it can start, like a tiny parasite,
Yeah, incorrect.
to the really intensive high-stakes care required to battle it.
Absolutely. And understanding the nuances of this condition, those subtle early signs, the delayed PCV drop that can really trick you,
Right.
the critical role of lactate as an early warning signal, and the specific challenges, particularly with periparturient mares, it just highlights how complex and how urgent emergency veterinary medicine can be.
It certainly makes you consider not just the obvious injuries, but the incredibly hidden dangers that our animal companions can face, often without any obvious external signs at all. What really stands out to you from our deep dive today? Maybe it's those specific risk factors for older mares, or that surprising fact that a parasitic infection can lead to such a catastrophic internal bleed.
For me, connecting this to the bigger picture, it really underscores the incredible resilience of horses on one hand, and on the other, the sheer precision and speed required in emergency veterinary care to give them the best possible chance at life when something like this happens.
Yeah. Well, we hope this deep dive leaves you, our listeners, not just well-informed, but with maybe a deeper appreciation for the interconnectedness of a horse's internal systems and the constant vigilance required from all of us who care for them.
And this understanding, knowing about such a serious yet sometimes hidden condition, well, it raises an important question for you to think about. How might this detailed knowledge actually change the way you observe or maybe care for the horses in your life?
Something to ponder. Join us next time for another deep dive into a topic designed to spark your curiosity and expand your knowledge.